over to you. Thank you.
Thank you, Bedelia. I'm just going to share my screen now, so I'm just a little bit distracted doing that. Now, I'll just go back to the beginning. Good evening, everybody. I'm delighted to be here and to see that there's so many people tuning in, whether you're sitting there with a nice big cup of tea, looking in on your laptop or iPad or phone, or just you might have us on in the background. So I'm just really going to look at a few of the common psychological features, really, or psychological symptoms of the menopause. So what they look like, how we can relate to them, and how we can manage them. And I suppose something that Dr. Cassie brought up is, you know, how we relate to the symptoms really does have an impact on, even at times, the severity of the symptoms and the frequency of the symptoms. So sometimes when we don't have the information, the way we relate to the symptoms can be from a place of fear. So it's just wonderful that we're getting so much information, because at least it can reduce the unknown, which is a really important thing. I suppose first, not that we need reminding about the midlife context, but, you know, sometimes as women, I think it's just important to recognize, you know, the 40s, the 50s, it's like there's so much going on in life anyway. So, you know, there's life changes, there's stressors, you know, you could be grieving for parents, there could be caring for elderly parents, parenting your children, there might be young children or teenagers, maybe children leaving home, some bit of that empty nest syndrome, family illness, managing work and home, meeting work demands, financial stresses, relationship problems, separation, divorce. You could be newly single and dating again, or, you know, living with COVID, which what we've been doing for the last 2 years. And of course, even aging. And, you know, there might be conflicting emotions for us as regards aging, you know, just changes in our bodies and even changes to our reproductive status. So this is all happening already just because of the phase of life we're in. And then, as I'm saying there on the slide, it's midlife context and the change. So now we already have those things happening in our lives in terms of the stressors and life changes. And, you know, when you think of yourself maybe as the resources you have and the demands, so what's going out, but then when you put the symptoms of menopause and perimenopause on top of that, and, you know, as Cassie said, up to 33, 34 symptoms. And I suppose up to 80% of women are going to experience these symptoms to varying degrees. And, you know, varying degrees of severity or disruption in our lives. So we have an awful lot going on. And I suppose maybe to take a pause even tonight and just acknowledge that, you know, we already have a lot going on in our lives, even before the perimenopause, you know, before that starts. So you might feel that you were just kind of managing, getting through all of those demands, and there's maybe people, you know, you caring for people and looking after for people and doing all of the things. And now we have nearly another stressor, another demand. But I suppose one thing that can come from maybe this time of our lives is that especially if you were somebody who is caring for other people and always being last on the list. So maybe with the symptoms, there is that it focuses our attention that we actually have to look after ourselves now. So it might be saying no and really focusing more on yourself. And as Jack Cornfield says, he's a psychologist and a meditation teacher. He said, if you have respect for yourself and patience and compassion, and with these you can handle anything. So I suppose even just to keep that in mind as we're just going through talking about the psychological symptoms. So I'm going to talk about brain fog and anxiety and depression. They're like maybe 3 of the more common kind of things that people would talk about. So then for brain fog can be very troubling for people. And I suppose it's really the cognitive impairment. And there's some studies that talk about a window of vulnerability for cognitive difficulties, particularly memory, beginning in early menopause transition, and then ending for some women and for most women post-menopause. So, you know, if you've experienced things, and we have a poll there, and you might just, if you want to use that function just to answer that question, Have you experienced symptoms like forgetfulness, you know, forgetting a word mid-sentence, forgetting names, poor concentration, finding it hard to focus and to put your thoughts into words? We saw in one of the videos that one of the ladies really was struggling with that, and also confusion. And I suppose we have touched, I suppose the other speakers have touched in terms of estrogen, and this has a potent impact on the brain, and especially in midlife, on memory performance. And I suppose a lot of people, you know, would say as well that they don't know what's going on. They wouldn't really have seen this, and that could be another question that's in there too in the poll. Whether you put down these kind of symptoms as to be, okay, this might be perimenopause, or whether you just thought, oh God, I'm just maybe really stressed out, and that's what it is. So for some people too at work, and I think one of the ladies in the video spoke about that, how up to 25% of women could consider leaving work because they just feel like they're not actually able to function in work. And even when people really don't know what's happening, and you know, you might walk into a room and go, God, why? I actually don't know what I've come in here for. Some people fear that it could be the early onset dementia, that this is what's happening. And especially if their mom or aunt or, you know, elderly parent has dementia, it can be absolutely terrifying. And they can hope that it just doesn't maybe come into their head that it actually is perimenopause. So, okay, I think this says, I'm just looking, it seems to have frozen my presentation, but I'll keep on going. These are the things that happen. So
Nodlaig, sorry, Nodlaig,
hi,
if you bring your cursor to the bottom left-hand corner of the screen and just click, it'll potentially bring up. There you go.
Oh, there we are. Lovely. It's great to have someone, Helena, around, especially when there might be a bit of brain fog. So Helena, I wish I had you every day when I just kind of lose my way and I'm not too sure where I'm going. So what can help? I mean, I suppose we'll all mention exercise. I mean, exercise is good for promoting brain health. Also, you know, just simple things like making lists of priorities for the next day. You know, it might be, we're kind of lucky now that we have phones and we can put reminders on, or the Post-its. So any kind of strategy that you find helpful, I would say just use those strategies just to get through those moments. Reduce multitasking. Now, in all fairness, multitasking is overrated, but especially when when our working memory, when we're just finding it hard to focus and maybe hold a number of things in our head, then multitasking isn't really the way to go. Stay hydrated. So that's vital for brain function. And also, if we can regulate the blood sugar. So, you know, the brain likes a steady flow of glucose. And then own up. There was one of the ladies in the video, and she said, you know, that she plays charades, you know, when she can't think of something at work. And I just thought it was just a lovely example of we just normalizing this and normalizing it for ourselves that are going through the menopause, but also educating and informing people that, you know, this is why I'm just getting stuck mid-sentence here. And then the good news is that the memory improves again post-menopause. So we'll move on then to anxiety. And I suppose anxiety is a common mood symptom, and it can be experienced by some menopausal women. And I suppose as well, if you can, with the poll, if you can just maybe say yes or no, whether you would have experienced the symptoms of anxiety. Just put that down. So things like irritability, nervousness, tension, feeling fearful for no reason, and that racing heart. And I suppose, again, it is the falling levels of the hormones, and they influence the way the balance of hormones in the brain. I suppose if you think of the hormones, it's nearly like an ecosystem. So, you know, with the reduction of the sex hormones, it's going to have that knock-on effect on other hormones and neurochemicals. So what we see is there is a lowering of the serotonin, and that's linked to mood regulation and your body's stress response, and of course as well to the memory function. And we also see that lowering of the endorphins, and we know these are to increase our feelings of well-being and pleasure. And then there's an increase of the cortisol and the adrenaline, and there are stress hormones. So then you can see there the irritability, nervousness. So the symptoms, they may occur randomly in response to a stressful situation, or they may be intermittent, maybe lasting a few minutes to hours, or there might be that mild ongoing sensation of feeling uneasy. I know for me, sometimes with this, I'm not really feeling anxious in my head. I don't have that anxious thinking, which I'll mention, but it's nearly like I'm after about 3 or 4 espressos. It's kind of like there's a surge in the body. And also just I'm waking up anxious. That might be something that some of you might notice. And there is a cortisol peak in the morning time, and that's really to rouse us, to get us going. But when we don't have that dampening effect of the serotonin and the endorphins, then we really feel the anxiety and the jitteriness, maybe a little bit more. So sometimes if you can just be really organized in the morning, that may be hard because you might be trying to get people and yourself out of the house. And it can be hard. It could lead maybe to more kind of anger or kind of irritability, because really your body is quite hyper aroused. Just going to mention as well anxious thinking. I suppose there's a flavor and a theme in anxious thinking, and we call it catastrophizing. Now this can trigger anxiety, but it also maintains anxiety. And it really is when we overestimate the likelihood of the worst case scenario, but then we underestimate our ability to cope. And then when we are thinking in this way, it automatically then increases these symptoms up here: the irritability, the nervousness, the tension, the feeling fearful, the physiological symptoms. So again, you're going to notice from my talk, there's a lot of circular kind of vicious circles, one thing feeding into another, and then the bidirectionality of it. So I'm just going to mention cognitive behavior therapy, that model. Dr. Cassie would have mentioned that as a very effective intervention for the psychological symptoms, especially if they're more in the kind of moderate or severe range, or even if they're really impacting of the quality of your life. So with the CBT model, really it focuses us to look at the links between what we think, our thoughts, our behaviors, our bodily sensations, and our emotions. So the way we think about the symptoms in certain situations tends to affect how we feel and then what we do. And these reactions in turn will have will increase the intensity of the bodily reactions. So there has been research, which Dr. Cassie mentioned as well, that CBT, and it was a kind of a group CBT intervention, which is always a lovely way as well, because you have that I'm not the only one experiencing this in a group intervention, but that CBT for hot flushes did reduce the severity and also the frequency. And I suppose really what it was that we were starting to change our relationship to the symptom, because, you know, this is happening. And, you know, there may be for some people the option of HRT may help with symptoms. And as Dr. Cassie said, it's not going to be the panacea, but it's, you know, when we meet a symptom with a more calm kind of, what's the word? Just, we will feel like we're more in control. So if you're watching it, for those of you that are listening, I'm going to apologize, but I'm going to try to explain this as best as I can. So I'm just giving an example using that CBT model, and it's of the anxious thinking. So if any of you have had the experience of waking up at 3 a.m. in the morning, and I'm thinking there could be quite a few of us now that might have this experience. You wake up at 3 o'clock in the morning and you are bright awake. And then the thoughts, remembering the catastrophizing. So, oh my God, it's 3 a.m. in the morning. I have a busy day tomorrow. I'll be totally wrecked and I won't be able to cope. And I'll get in trouble at work because, you know, I already have the brain fog and I'm forgetting things. So that's what we're thinking. And then the feeling, we're starting to feel anxious, stressed, worried, annoyed. So when we're feeling that, and in this example, the woman might actually get out of bed and just go, oh, I'm just going to go down, get out the laptop and start going through my emails, you know, get a start on the day. So then she finds herself at the kitchen table going through work emails at 3 a.m. in the morning. So then we look at the body, what's actually happening in the body. So she's feeling hot, her heart is jumping, her head is pounding, and there's that edgy kind of feeling. And if you see, there's a bit of a vicious circle starting to go on here then. And even imagining, you know, what state she's going to be in, looking at work emails when she's in this state. So there better not be any alarming, troublesome emails there, because it's only going to go downhill. So she may find herself at 7 o'clock now, sure, I might as well just stay up altogether. Now, when we look at the thoughts, it can be important just to ask ourselves a couple of questions. It's like, if my best friend just appeared in the bedroom, you know, what would she say to me? Or if my friend was in this situation, what would I say to her? So my friend might say, or using that question, what would I say to myself? You know, if this is my best friend talking, or what would I say to my best friend? And it could be, I've actually managed before, so I know I can cope. You know, I've woken up in the middle of the night before, and I've always thought maybe that tomorrow is going to be brutal. And it actually, I'm tired, but it's not a total disaster. So I've managed. And then with thinking this, we then can start feeling a little bit calmer, a little bit okay. And then the behavior is, she might just say, I'm going to practice a little bit of belly breathing. So that slow, steady breathing. And the belly breathing is if you breathe in for 4 counts and if you breathe out for 4 counts. So we're really purposely trying to slow down the breath. Sometimes when I find myself awake at 3 o'clock in the morning, I'd put just the palm of my hand down there on my lower abdomen, just below around my belly button. And I bring my awareness to the sensations. And as I breathe in, the belly is rising, and I say rising in my head. And as I breathe out, the belly is falling. So then I'm saying rising and falling. I might have one of those catastrophizing thoughts, and I just go, okay, I'm going to bring my attention back. And the rising and the falling. So you're really trying to slow down the stress response and bring yourself down. And then, you know, this lady puts on some soothing music as well. So then we see, well, what effect does this have on the body? So the heart starts slowing down, the tension starts releasing.
Just 3 minutes now, Nodlaig.
And then there's a cooling down. So then the thought of, I'll deal with tomorrow when tomorrow comes. So then what can you do then? I'm going to need to go a little bit over, Bedelia, because I was a little bit late starting. So the paced breathing and just developing a calmer, self-supporting internal dialogue. So is there really a threat here? So I'm lying here in bed at 3 o'clock in the morning. I don't know how tomorrow is going to be. What would a close friend say? What would I say to the close friend? And how can I best mind myself? Have I managed this before? So also with the anxiety, meditation can be helpful. I have put into the chat, there is a Palooza meditation website, and they do mindfulness-based stress reduction. It's free. Now it is self-directed, it isn't interactive, but it's all there if you wanted to go through it. Also yoga. Again, the exercise, reducing the smoking, or quitting the smoking, the alcohol. I'm going to say sleep well helps the anxiety, but we know that's a vicious circle. And then connecting with friends is very important, especially if they're friends that are understanding and they give us a bit of a different perspective. And then taking a break, you know, those times around irritability, it could be important just to say, I'm just going to go out and take a deep breath. And then asking for help. I think it's really important to ask for help. And in my work down through the years, people avoid asking for help. And when I ask them, you know, how is it it's taken you so long to come for help? Or even this could be just asking for help within your family or with your friends. And they would say, I don't want to be a burden on people. And if I ask for help, people might think I can't cope. So I'm going to very quickly go through the depression. So 18% of women in early perimenopause could experience depression, and 38% of those in late perimenopause. So women in perimenopause are more at risk than in postmenopause for depression. Again, just like with the anxiety, those who might have a history of depression, maybe if you received treatment for depression in the past, You may be more likely to develop the depression if there may be a relapse during menopause. And also if you have quite significant, I suppose, severe PMT, that just shows that the mood is quite sensitive to the hormone changes. And then looking at the symptoms: anger, low mood, decreased self-esteem, feelings of isolation, worthlessness, decreased libido, and low energy. And then the depressive thinking is more really about being critical of yourself and being negative about, I suppose, yourself, and also about the future and about the world in general. And we can get into a cycle of self-criticism and hopelessness, and then we can end up withdrawing. And I suppose when we do that, then the depressive feelings and the depressive symptoms will only get worse. And again, looking to see how we meet the symptom of the menopause. And in this situation, it's when you have absolutely no energy. And the thinking here is more negative. So I'll just go through it really quickly because I am conscious of the time. So finding yourself having absolutely no energy. And then what goes through this woman's head is, oh, for God's sake, I should be able to do all the housework. I'm losing my grip. I'm just not good enough anymore. I should really cop on. And then the feelings with that are frustration, sadness, depression, disappointment. And then she just decides to go to bed and cry. And then the sensations in her body, feeling empty, muscles aching, sore, heavy. So then if, again, using that of what would you say to a friend in this situation? Or what would a friend say to you? So I'm tired. It doesn't mean that I'm not good enough. I've done a lot already. And then maybe feeling more content and proud. And then the behavior is, actually, I'm going to put my feet up and get a cup of tea. And then the body, again, the muscles are going to be relaxing, the chest easing, and then that lovely self-compassion. I'm actually okay and going through the menopause. I just need to give myself a break. So then what helps? If you find that you have withdrawn and the activity has gone down, it's really important to just start to gradually do things that you enjoy. You know, we call it kind of scheduling pleasant activities. Get out for the exercise, again, the smoking, cutting down the smoking and the drinking excessively. Really important to meet up with your friends, really important with family members that won't drain you, that will actually give you a different perspective and be supportive of you. The diet and the sleep, gratitude. This is a lovely practice where you can put down 3 things you're grateful for every day, and they could be just small things. I'm really grateful that I have Helena that came in and just helped me when I couldn't find my screen share. And again, developing more of a compassionate voice. I have something put in there, a website, Kirsten Neff. There's a lot in terms of self-compassion exercises in that. And really the question, is it an accurate view to really say, I'm not good enough? I'm just experiencing a symptom that is related to the perimenopause or menopause. And what would the close friend say? And what would I say to a close friend? Again, it's so important to ask for help and not to suffer in silence. So I know I had to sort of fly through a little bit, but just to finish, and this is just a quote from Dr. Jen Gunter. She is a gynecologist in America, and she calls herself a fierce advocate for women's health. And this is what she tells herself when she experiences a hot flush. She says, I am feeling this because women have evolved to drive humanity forward, and this is a sign of my strength. So I'm going to finish up with playing a clip of another fierce, strong lady, and you might recognize her. So Helena or Jean, I'm going to ask you to play it for me. Thank you, everybody.
And I think we found it.
Is that maybe a little young?
I don't know. Exactly how old do you think I am? And not that it matters, but I am 50-fucking-2 and I will rock this dress.
I'll get you a changing room.
I'm sorry, but do you have any drugs in your luggage?
No, just my hormones. You gotta be kidding me.
I'm sorry. It is just a UAE law.
But they're all natural. They're made from yams. Okay, I need to speak to an ambassador or an embassy or someone in menopause.
Samantha, please calm down. This is getting very, very Midnight Express.
Fine, take them. Without those creams and vitamins, I will go ricocheting back into menopause.
Relax, it's 1 week.
Tell that to the beard I'll be growing.
Well, Nodlaig, I'm telling you now, I'm going to practice my gratitude and thank you. Thank you for your presentation. It was wonderful and full of just practical advice. And we always, I suppose, when it comes to looking after our mental health, maybe we're not so good as we are with looking after our physical health. So it's always good. There was really practical advice that we can all apply. I think we can all relate to a lot of the feelings that you talked about tonight. So thank you so much for sharing all that with us. And thank you for a little that clips of Sex and the City and take us all back memory lane. And let's go and watch that movie again.